Do you ever find yourself waking up during the night to use the bathroom? Isn't that incredibly frustrating? Not only does it interrupt your sleep, but it can leave you feeling terrible the next day. So what can you actually do about it? Well, today I'm Dr. Rena, a urologist and pelvic surgeon, and I'm going to share 8 helpful tips to reduce how often you wake up at night to urinate. And if you enjoy my content, don't forget to give this video a thumbs up, subscribe, and tap the notification bell so you never miss when I post new videos each week. Now let's jump right in. What are 8 simple ways you can cut down those nighttime trips to the bathroom? First, and most importantly, be mindful of what you drink in the 2 hours before bedtime. Try to stop drinking fluids about 2 hours before going to sleep, and if you need to take medications at night, just use a small sip of water. If you drink a lot before bed, your bladder will naturally fill up more quickly, making you wake up sooner. Even I notice that I wake up at night if I drink too late, so I make it a point to stop a couple of hours before bedtime. Also, certain drinks in the evening, known as bladder irritants, can increase bladder activity or spasms, making that urge to wake up more frequent. So what are these irritants? I have an entire video explaining them and why they cause problems, but the most common ones I see are caffeine and alcohol. There are others as well, but they don't affect everyone the same way, so be sure to watch that video to learn more and how to manage them. Number 3 is using the bathroom twice before bed. What does that mean exactly? In urology, we call it double voiding. Basically, you sit down, empty your bladder, then stand up, move around a bit, and sit back down to go again. This can help if you're not fully emptying your bladder the first time. By doing this, you may empty more completely and hopefully sleep longer before needing to go again. Number 4. If you're taking a diuretic, also known as a water pill, talk to your primary care doctor about when you're taking it. You definitely don't want to take it right before bed, or you'll likely be up all night. Taking it in the morning can sometimes lead to fluid building up again in your legs or lower body by nighttime, which can then increase urine production later. Ideally, taking it around midday may work better, but always check with your doctor before making any changes. Number 5. If you have diabetes, it's very important to keep your blood sugar levels under control, especially in the evening. Extra sugar in your system can end up in your urine, irritating the bladder and making you wake up more often during the night. Number 6. Try to limit your salt intake, particularly if you have conditions like congestive heart failure or swelling in your legs. Too much salt can worsen fluid retention, which again leads to increased urine production later on. Number 7. Consider wearing compression stockings or elevating your legs in the evening before bed. This can help reduce any fluid buildup in your legs, allowing your body to process it earlier and helping you avoid waking up as often during the night. And lastly, number 8. Kegel exercises. I've talked about these before, along with pelvic floor physical therapy, and you can check out my other video for more details. But specifically for nighttime urination, you can use what we call urge suppression techniques. When you feel the urge to go, try doing 3 to 5 quick Kegel exercises and wait for that strong urge to pass. It will peak and then fade. Once it settles, you can calmly go to the bathroom. This helps retrain the connection between your brain and bladder, teaching your body that it can hold urine a bit longer. In fact, studies have shown that after about 3 months of practicing this regularly, people reduced how often they wake up at night by about 0.4 to 1.2 times on average. That number might sound small, but it could mean waking up 1 less time each night, and that makes a big difference. Most importantly, it can improve your sleep quality and overall well-being. We've all experienced how a poor night's sleep can make the next day feel completely off. Alright, I hope you found this video helpful. Thank you so much for watching, and as always, remember to take good care of yourself, because you truly deserve it.